Okay, great. I'd like to thank everybody for attending the Aptitude 2020 webinar series. Today is our second installment, and it features Michael Hobbs from Greiner Bio One. We're excited to have Michael here today, as phlebotomy has been a hot topic as of late. And he's going to share his thoughts and provide just an overview of solutions based on the current market dynamics. As I mentioned, this is our second series, and in last month we had Cordis, and we have several interesting topics coming. We have, for the next several months, we have several suppliers who will be talking about new solutions coming to the market, and as always, you guys are welcome to join. We will record all of these, and they will be available on demand on our website. The format of the 2020 series is 20 minutes of presentation and then 20 minutes for Q&A. And so it's designed to be kind of short, sweet, and allow you to get up to speed on what's happening in the market. Real quick, before I turn it over to Michael, just a few words about Aptitude. For those of you who are unfamiliar, we've been around for 5 years now, which for a startup is quite a significant milestone. We've seen over $1 billion in volume in that time, including a significant increase in PPI or med device contracting in the last 18 months. And we do support most medical, surgical, and clinical preference areas. Just at its genesis, Aptitude combines data, technology, and people to help providers and suppliers to reduce contract cycle time and also save money. Specifically providers love the ability to take action on opportunity and sign new agreements on average of about 45 days, while suppliers enjoy the ongoing monitoring of market share. And for that transparency, you're actually offering providers additional savings up to 10 to 15% on average, and in most cases without conversion. So just a quick introduction to Aptitude, but we're here to talk about path for providers to keep phlebotomy products on an agreement, which seems to be, like I said, a hot topic. So I am going to turn it over to Michael.
Hi, thank you, Justin. Just making sure everyone can hear me. So I'm going to try to share my screen. So if you give me just a second to start, that would be wonderful.
And maybe a quick reminder, if you guys could also mute your lines, that would be very helpful. Thank you.
Justin, are you seeing my screen?
Not yet. Just a second, I should. Did you get the presenter privileges?
I think so, yes.
Yep, okay. There we go.
Okay, perfect.
Got it.
Okay, so I wanted to thank you guys for taking some time out to spend with myself as well as my team. I would love to say I am the expert on all things Greiner, but that is not the case, and I do have multiple members of my team on this WebEx as well. So when you guys start asking questions, I will do my best to answer, but if not, I may have to hand it off to some of the other members on my team. So obviously, for those of you who have not heard of who Greiner is a global player. We currently work in over 100 different countries. We have over 2,000 employees. We have all of our products on all major GPOs, obviously including Vizient as well. So we have gotten into the U.S. market starting in 2004. We have seen dramatic growth over the years as more people start seeing Greiner, understanding who Greiner is. They're able to improve safety, leverage some diversity in their purchasing, as well as reducing costs, which shows the explosive growth that we've really seen from 2011 through 2017. So we are working with Vizient with the changes in the phlebotomy contract for an implementation. We would love to say that we are able to take on every Vizient customer right at this exact second, but we have found out about this change in contractual obligations about, I think it's now been about 7 weeks ago. So we have been adjusting everything that we do internally at Greiner to be able to handle as many and all of Vizient's customers as quickly as possible. We are doing this in a phased approach. So this presentation, while we're going through the different products, we will be kind of doing this in a phased approach so we can show you in phase 1 what we're looking to convert compared to phase 2 and 3, as well as working with all the distribution partnerships. So phase 1, these are the products that are readily available right now while we're ramping up production on our other phased products. This includes the Vantage Blood Collection Set, our urine products, our MiniCollect, which is our capillary collection system, and some of the other various accessories that Greiner can offer. So the first product would be our Vantage Blood Collection Set. This is a spring-loaded system that allows for in-vein retraction to help reduce needle sticks. This is a one-handed activation. It looks a little bit different than your typical butterfly in the sense that we actually have stable arms up in front. This allows us to put the trigger mechanism on the side to make it a little bit more robust so the butterfly isn't accidentally triggered while it's in the patient or the container, causing you have to restick the patient or potentially just throw the butterfly away because you didn't get a chance to use it. Once you depress the button, it actually does clamp the tubing, which allows a closed blood system so you don't have dripping blood everywhere. So the next product would be our urine collection products. As you can see, we actually have a urine cup with an integrated transfer device. We also have a different type of urine cup that allows you, if you can see in the picture, the white cup with a little yellow spot on the top that allows you to use our urine transfer device to go in through that port. Once you pull the urine transfer device out, it self-seals back up, and we have a full supply of urine tubes as well. So one of our new products on the market that's readily available as well is our Urine CCM Tube. This tube is optimal for microbiology. We're able to claim that it stays stable for 48 hours at room temperature. The improved solubility obviously is going to ensure immediate stabilization of the sample. So our capillary collection system, we call it MiniCollect. It's a little bit unique and a little bit different. On the top of our cap, there's a little split septum that allows you to access the tube via a funnel or a capillary straw based on clinician preference. Once you pull those, the straw or the funnel out, it self-seals back up as well, so you eliminate the risk of spilling the sample. We also offer in our capillary collection, a MiniCollect system, a coag tube. It is used with our venous blood, though. We also have the various carrier tubes to go along with it, whether it be a clear one or if you have the need of an amber tube for your bilirubins or any light-sensitive analytes, we have those options as well. We are actually working on a redesign of the product. It is pending our our 510K submission right now. So we're just waiting on the FDA for some new updates to this system as well. The other items that are available at this moment would be our Lancets. It's a simple Lancet in the sense that you just take the little starting cap off. It's a pressure activation. We have various gauges and sizes to work for your patients. The other accessories that we have that are available would be just kind of your standard holder. We have snap caps for the top of the tubes. You have secondary tubes. And we have a blood culture holder for those of you who use the BioMiraU products. So our phase 1 products, this is kind of a listing. And once we're done with this, again, feel free to ask any questions. And when we're done, I'm happy to send out a copy of this presentation so you have this list in front of you to work with when you're looking through these phased products. So our phase 2 would be our blood collection tubes as well as our male and female transfer devices. So the blood collection tubes made out of PET plastic. We have the spray-dried additives. We have a double-walled coag tube with a liquid additive. We do have a secondary identifier. If you can see on the top of the caps, we actually have different color rings, and those different colors will indicate a little bit more about the tube, whether it be a white ring like you can see in the pictures right there that shows either a pediatric or a low volume draw, or if you see a yellow ring, which would indicate a gel within that tube. All the colors still stay the same as the industry standards. So one of the questions that come up is how do we switch from our current supplier of tubes to the Greiner portfolio? And there's a difference between a validation and a verification. All of our tubes have been validated. We work with all of the current suppliers of platforms to make sure that they work on all the major platforms that are on the market today. The verification process is to run tests that are unique and that are highly used by your own facilities to make sure that you're verifying with the CAP and any other accredited organization you work with to show that a 1.0 in one tube is the same as a 1.0 in your current tube. On the screen is just a sample of what we can provide of what we typically see in the industry. Again, this is not inclusive of all tests you have to do. You're able to then adjust this as you need to, and your local account manager can work with you to supply you with tubes that we provide at no cost to any of the hospitals we work with, and then we can customize that verification to your organization. When you are done running the verification, we will actually do the data crunching for you. One of the other comments we hear a lot is we just don't have time to do the analysis. You are able to give us the raw data. We put it into EP Evaluator. We spit out the results. We can give you a copy of that EP Evaluator, no charge. It's a free service that we offer, as well as with the original data so that you can see that the numbers haven't been fudged and that we are being accurate with what we're reporting to you. The male and female transfer device, we call our male transfer device the Holdex, is a direct access lure slip device. We are working on a lure lock device that pending an FDA clearance. We also have on the very top, which would be the female transfer device, which we call our blood transfer unit. This allows you to transfer the sample safely and while maintaining the sample integrity from a syringe. So this is a list of our phase 2 products. Again, I can give you this list after the presentation. Our phase 3 would be our more manual butterfly called our VACUETTE Safety Blood Collection Set, our straight draw needles, as well as our Vizio needles, which are a little bit unique that I will show you here in a second, and lure adapters. So our more manual butterfly, as you can see in the pictures, it's designed for in-vein activation. The body is mildly light blue. It actually helps accentuate the flash that you get. We have a non-kinking tube so it doesn't curl back up and kind of bite you on the back end. Another unique feature that we have with our butterflies that do not have a holder pre-attached is we actually keep our lure adapter on the back end with a little plastic sheath on it to protect the clinicians from needle sticks as well. Our straight needle we call Quick Shield. We actually give you 2 options of needles. We have our standard needle, which you will see has kind of the green body in the middle. The other option we have, which is unique to Greiner, is the VACUETTE Vizio needle. This allows you to see a flash so you know you're actually in the right spot in the vein. Anecdotally, this potentially could help you reduce the amount of butterflies you use. So again, this is a unique feature to Greiner. And again, here's our list of phase 3 products. So one of the things that Greiner truly does shine is our training, our support, and our continuing education. We work with you to design and develop a transition plan to switch to Greiner. When you do go through that, the implementation process, we actually have a team of product specialists that are clinicians themselves that can go in and work hand in hand with your staff to make sure that they're trained properly, they understand how to use it as safely and for best practices. We are also able to create customized training materials for you. We have demonstration videos, lots of different educational tools. If and when you do switch to the Greiner tubes, we can actually create custom tubes, so we can show pictures of all the tubes you currently use and what they will look like. I mean, a green is still a green and a red is still a red, but there's a little bit of a shade difference, so this way we can make sure that it's customized for you. We can put your organization's logo on it and make it special for you. We have an amazing customer support that's available 8 to 7 Eastern Standard Time. We are more than willing to go back in on site and help as needed. And then we also offer continuing education. We have complimentary webinars that give you CE credits. We have the Global Summit on best practices that we actually host at Greiner Corporation in Monroe, North Carolina. So if you want to take down the information, and if you feel like emailing me or calling me with questions that don't get answered, or after you look at this, you say, you know what, I have a question that I forgot to ask, feel free to give me a call, send me an email. And if you send me an email, I'm more than happy, like I said, to send you a copy of this presentation so you can see what is on our phased process. One of the other things I wanted to briefly discuss is we are working with all the Vizient members when you're looking for a conversion to our products. There's a large influx in customers, and we want to make sure that we're taking care of all the customers the right way and we're not over-promising and under-delivering. So we worked with Vizient to create a confirmation letter. This confirmation letter, once you get to that point, basically confirms that you're going to switch to Greiner, and we put you in a queue system so we can say, Hospital A, you put your confirmation letter in, you are number 6 in line to convert. This way we can best send our resources out and schedule our resources to help you with this conversion process, as well as making sure that we have the appropriate product and the support there for you as well. And I can send that copy of that letter to you as well. The letter has no financial implications. It's just we're confirming we're going to switch to you. If you change your mind, no harm, no foul, but at least lets us put you in a queue system to help you out. So on that, my portion of the presentation is over, and I will open it up for questions.
Great. Thank you, Michael. Good stuff. If anyone has a question on the line, feel free to ask it now. Michael, maybe could you elaborate on how business going through Aptitude, how it's going, and what are the reactions for some of the customers you've been working with?
Sure. So the process of working through Aptitude is amazingly quick. I think I've had an average turnaround once these RFPs come in of between 3 to 5 days. And I've had actually some very good positive response. We've actually already had a few contracts and RFPs signed, and we're working towards that conversion process with a few customers right now. For those of you who may or may not have worked a lot through Aptitude, it is a very slick system, and it works very well from a supplier standpoint.
That's great. I know on average we're seeing contracts executed within 35 to 45 days. So you guys are actually seeing a lot of movement. So that's great. Before we sign off, are there any other additional questions from anyone on the phone? Okay. Well, with this, we have recorded this, and this will be available for others to share. And we'll, as a follow-up, we will send out contact information for Michael. So, Michael, thank you very much, and appreciate everyone's time today.
It's my pleasure. Thank you very much.